The aed10 is designed for simple 1-2-3 operation during an emergency. If an emergency situation presents itself, the first thing to do is contact local emergency services immediately. Begin to assess the patient by checking for a pulse or determining signs of blood circulation and breathing. If the patient is not breathing and has no pulse, identify someone trained in CPR and begin CPR as quickly as possible. Continue CPR until an AED unit is brought to the scene. Position the aed10 near the patient's left ear. To start the aed10, push the green on-off button next to the large number 1. The aed10 text and voice prompts will guide you through the rescue.
Apply pads to patient's bare chest. Connect cable.
For defibrillation to be effective, it's important to correctly place the pads on the patient and connect the electrodes to the aed10. Before applying pads to the patient's chest, be sure to remove all clothing covering the patient's chest and wipe off any water, moisture, or perspiration. Remove body hair as needed to ensure that the electrode pads make proper contact with the patient's chest. To attach the electrode pads, peel off the backing from the electrode white pad labeled RA. Place this pad just below the patient's right collarbone. Peel off the backing from the electrode blue pad labeled LL. Place this pad over the ribs on the patient's left side below the breast. Plug the pad connector into the aed10 on the left side of the unit, if not already pre-connected. If the pads are not properly applied, the user will be alerted with text and voice prompts.
No shock advised.
When the pads are properly applied, the aed10 announces
Analyzing heart rhythm.
and then automatically analyzes the patient's heart rhythm to determine if a shock is needed. Rhythm analysis takes approximately 8 seconds. During this time, do not touch or move the patient. The aed10 will only administer a shock to a patient exhibiting a shockable cardiac rhythm. A sophisticated algorithm safeguards against inappropriate shocks. If it is not a shockable condition, the aed10 will alert the user with text and voice prompts to perform CPR to resuscitate the patient. The aed10 is programmed to follow the American Heart Association guidelines for defibrillation, which are 200, 300, and 360 joules. Other energy selections are available for your specific needs. To deliver a shock, make sure the shock button next to the large number 3 is flashing. This indicates that the unit is ready to deliver a life-saving shock.
Shock advised.
Also, make sure nothing is touching the patient before you press the shock button. If others are present, loudly announce, "Stand back. Do not touch the patient."
Press the red button now.
Push the flashing shock button to deliver a shock.
Shock delivered.
After delivering a shock, the aed10 will continue to analyze the heart rhythm and determine whether additional shocks are needed.
Analyzing heart rhythm.
If directed by the unit, perform CPR in accordance with the procedures and techniques presented in your CPR training. At the end of the CPR cycle, the Welsh Allyn aed10 will prompt you to stop CPR and not to touch the patient so it can assess the patient's heart rhythm and determine if a shockable condition exists.
If no pulse, start CPR.
Continue the CPR cycle until an EMS team arrives on the scene.